Stories have been emerging about the GLP-1 drugs, the Ozempic type drugs, causing apathy. They're calling it Ozempic personality, which is wrong. It's not what's happening. Have you heard about this?
No.
Okay. So much like addiction is a motivational disturbance, the motivation to use takes over, all the other priorities of life shrink, and pursuing the drug becomes the sole priority. Even when the drug is destroying your life and you hate it, you still want it, which is the brain has two systems, a wanting system and a liking system. You can both want and like things, or you can want things that you don't like, but you still want them, right? The wanting part is what gets down-regulated by the GLP-1s. So you don't want anything. You don't want to go to work. You don't want to have a sexual object. You don't want to have meals. Everything's just, and you're not depressed. There's not an emotional component to it because you still like all these things. You just don't want them. And so that just has had me thinking, just a general lack of understanding and priority given to motivation, motivational priorities, moral compasses. Where is our moral compasses heading, and how do we tune those up? And just generally what makes a good person and a good life, right?
I don't and have never used Grubhub because I don't believe it. I don't believe in it. I don't believe it like some people have a religion and they kind of just know what they know. And I know that's bad.
I just left the doctor's office. I went to get a checkup because I've been off of Ozempic for 2 months now, and I just wanted to see if my body was in better condition, if there were any permanent damages. Kind of in shock right now because I wasn't expecting this, but I guess Ozempic can cause bone density loss, and I didn't think that would happen to me because I was only on it for a year, but I have significant bone loss. I have osteoporosis and osteopenia, so that I don't know, there's like several of them that I have. I wasn't expecting that, but that's what happens if you use Ozempic for weight loss and you lose too much weight.
If you or someone you know is on Ozempic or Wegovy, you need to hear this. There is a new federal lawsuit that just got very real. Federal judges just created a brand new multi-district litigation over GLP-1 weight loss drugs and alleged vision loss. So this is separate from the massive stomach paralysis lawsuits you may have already heard about. Patients are suing Novo Nordisk and Eli Lilly, claiming that drugs like Ozempic, Wegovy, Trulicity, Zazinda, they caused a condition called non-arteritic anterior ischemic optic neuropathy. In plain terms, blood flow to the optic nerve drops and then people lose part or all of their vision, sometimes permanently. So the court agreed that these cases are medically and legally different from the gastroparesis cases. So they created a new MDL in Philadelphia. So same judge, different injuries, different science. As of now, there are about 30 federal vision loss cases and over 40 more in state courts. So that number is expected to grow, especially after a July 2024 study had flagged this risk. So this is why it matters from a nursing perspective. These drugs were designed for diabetes. Weight loss use exploded faster than long-term safety data could catch up. So vision changes are not a side effect you ignore, downplay, or wait out. So from a legal perspective, this means one thing. The courts believe the claims are serious enough to manage together. So this is not a random lawsuit. This is coordinated federal litigation. The companies deny the claims and argue the risks are known and that they cannot change the drugs without FDA approval. So that argument will now be tested in court. So if you are taking a GLP-1 and you're noticing vision changes, stop dismissing it, document it, report it, and you need to be evaluated by a medical provider. Medication convenience should never cost your eyesight.
I feel like there's a side effect of Ozempic no one really talks about, and I feel like so many people are probably experiencing this and they don't know whether it's something with their body or whether to associate it with the medication. So let's get into it. Have you ever just like been minding your business and you're sitting around or you're walking and maybe your arm just feels like really weird, like really sensitive to the touch, or maybe your thigh or any part of your body? What you're experiencing is skin sensitivity, and it is definitely a side effect of the medication. Now, before you panic, it is not a serious side effect at all. We're not talking about rashes, okay? We're just talking, I can touch myself right here and it's like, ooh, that just feels a little sensitive. It doesn't hurt or anything, but it just is like, that just feels a little odd. Now, I'm not a doctor. I'm just someone that's been taking the medication for almost 2 years. But from my research, it seems like it can either be nerve sensitivity or hormonal changes. Rapid weight loss from GLP-1 medications can sometimes just cause nerve sensitivity. Okay, so I'm sure you're like, okay, girl, you're saying it's nerve sensitivity, but what can I do about this? Well, maintaining a balanced diet with B vitamins and electrolytes can really help support nerve health. Now, when it comes to hormonal changes, improved insulin sensitivity and rapid weight loss can definitely shift hormone levels. And sometimes this can just cause skin flare-ups or sensitivity. If you're noticing this, maybe just be a little more gentle with your skin routine, avoid harsh exfoliants, things like that. So if you have been experiencing skin sensitivity, while it is not common, it is a side effect of the medication. I've experienced it. I mainly will experience it on my thighs or in my arms, and it just goes away within a couple of days. So
you can't get off of it. If you go to get off of it, you gain all the weight back. It never solved the root cause problem. It wasn't made to help you lose 10 pounds. It was for the person that was about to lose a limb. We've now using it for people to lose weight so they can feel better about themselves. Okay, in that concept, we have a couple problems. For starters, it's expensive. So now you're on $1,000 a month to keep the same weight. So Ozempic kills hunger. And that's one of the reasons it's causing people to lose weight. You need food to make hair and nails and muscles and hormones and neurotransmitters. We don't know what it does to the microbiome. And the microbiome is what is making serotonin that keeps us happy. The microbiome, there's a set of bacteria in our gut called the estrobolome that break estrogen down. If we destroy our microbiome, you destroy your body and you destroy your mind. The last one that I will tell you is that it's the empowerment piece. When I inject something into me and I lose weight, who do I give credit to?
Ozempic, you're codependent.
What happens when the human forgets how powerful they are? Let's not rob a woman of the experience of figuring out how to drop weight. And by the way, a fasting lifestyle will give you the same weight loss result and save you money as Ozempic. And you walk out of that and you are like, I'm a badass. I did this. I did that for me.
People who try to shame me out of talking about the risk of Ozempic, here you go. It causes stomach paralysis, aka gastroparesis. Just 16 days ago, I made a post on how I was concerned for how many people are now using Ozempic for weight loss and for diabetes. And I got blasted in the comments. But now even People magazine is talking about the side effects from this drug. Stomach paralysis is not something to laugh about. It's a very serious condition. What happens is that something called a bezoar is formed in your stomach, which is basically just food that wasn't able to leave the stomach and enter into the small intestine, which may require surgery and could even lead to you no longer being alive. In my initial post, I talked about my concerns about the pancreas and my concern that it could potentially cause pancreatic cancer. But many of you actually made me aware of the fact that you are not to take this drug if you have any history of thyroid cancer or thyroid problems, because it is known to potentially cause thyroid cancer as well. So again, I'll say it, stop trying to take the easy way out. If you have weight issues or hormonal imbalances and pancreatic and ovarian issues, taking a drug is not solving the root cause.
Every 6 pounds of fat a person was losing on these drugs, they were losing 4 pounds of fat-free mass or lean mass. So 40% of the weight they were losing on these drugs is coming from lean mass, like including muscle and bone. So there are now case reports of young, healthy women who were overweight, who go on the drug for some period of time, and after they get diagnosed with osteoporosis, where they have eroded their bone health. They're losing lean mass. When you take enough of that drug that you just have no more hunger because of how it's acting at your brain, you do just stop eating. And the malnutrition, at least in part, is going to cause a loss of lean mass. There was a paper recently published with the use of these drugs, finding that people, when they begin the drug, their risk of suicidal thoughts doubles. It goes up by over 100%. And their risk of major depression triples.
Listen, if you're on a GLP-1, this is not about shaming you. There may be a very good reason your doctor put you on one, but if you are tempted to take a GLP-1, I need you to know two things. You are trading one health metric. If you're going for fat loss, you're trading that health metric for another health metric. We're talking about muscle loss. Muscle is your metabolism as well as your longevity. We're talking about osteoporosis. We're talking about malnutrition and your mental health suffering. Again, you're trading one health metric for another. And what so many women don't understand is that your body already makes GLP-1. It is produced by L cells in your gut. These L cells are nutrient sensors. When they sense protein and when they sense fiber, you're going to release more GLP-1. This is a call out to all women. Please know that you can boost your GLP-1 naturally. You do not need to take an injection. You do not need to take a pill. This may seem like a shortcut, but in the long run, you could be doing way more harm than good.
We have a friend that's a nurse, and a couple months ago, my husband owns a brewery. He's a microbrewer, and she came to the brewery and was like, she just sat there with her head in her hands, and I was like, "What's wrong?" And she's like, we just had like the third case of pancreatitis for the day, and I'm just like so over it. Yeah. And I was like, what do you mean the third case for the day? And she's like, oh, people are coming in left, right, and center with pancreatitis because they're taking too much Ozempic.
So I had a bunch of people flooding my inbox with this article from CNN talking about Ozempic and leading to intractable nausea and vomiting. So the article is titled Causing Gastric Paralysis or Stomach Paralysis. Just so everyone knows, this is a common side effect of a GLP-1 agonist. This is how it works, by slowing how your stomach empties. My concern is that some patients do have a low level of gastroparesis or stomach paralysis. In fact, one of the most common causes of this is uncontrolled diabetes or long-standing diabetes, which leads to autonomic neuropathy. And one of the major presentations of that is slowing of your stomach emptying. So with hundreds of thousands of patients on these medications, it is conceivable that some patients may have a low level of this, and taking these medications can worsen this condition. So I totally agree with this, weighing the benefits and the risks. This is something that's extremely important. If patients have issues with nausea and vomiting, you shouldn't be kind of pushing this and increasing the dose. Speak with your doctor.
A woman has died after taking Ozempic to slim down for her daughter's wedding. 56-year-old mum Trish Webster managed to lose a total of 16 kilos after starting the drug that's traditionally used for diabetes. Husband Roy said that while his wife was losing weight, she was also frequently ill, often suffering from diarrhea and nausea. One day, brown liquid started coming out of her mouth and she wasn't breathing. Doing CPR, it kept pouring out, and tragically, Trish passed away that night on January 16, 2023. Her death certificate states that the cause was an acute gastrointestinal illness, and while the coroner's conclusion doesn't draw a direct link to the drug, Roy believes it contributed to her death.
If you're using Ozempic or plan to start using Ozempic, you need to watch this video. I have a patient that came in the other day who's been on Ozempic, and I hadn't seen her in a few months, and so she has lost a significant amount of weight, which has been really good for her health, everything. But I noticed she looked like weaker, a little less balanced. I was like, this is, something is off about the way she's moving compared to how she used to move. I've known her for years. I'm gonna be real honest, I don't know all the physiology behind it, but my really smart coworker does, and she went to a class recently that said basically it doesn't discriminate between one type of tissue and another. So like it's taking away, breaking down fat, but it's also breaking down your muscle mass. So it is highly recommended that if you are on Ozempic that you strength train. I think she said the recommendation, she's like, I tell everybody that I know that's on Ozempic that they need to strength train for 30 minutes a day, because it takes your muscle with it, and our muscle it's everything for our longevity. I mean, our muscle mass is a significant indicator of our lifespan, how long we live, how easy it is for us to live a quality life. So if you are taking Ozempic and you're not doing any strength training, please start.
Those first 24 or 48 hours on Ozempic or another GLP-1, or just the first week on any diet, low carb, low fat, less calories, more exercise, you might notice yourself urinating more frequently. This is actually really common when you start a new diet because of the diuretic effect of reducing calories and reducing carbohydrates. Each molecule of carbohydrate stores water with it. So when you reduce calories and carbs, you'll lose body water through the urine. So don't be surprised if you notice these side effects.
Hi, Dr. Verma here, heart surgeon from Toronto, with some hot off the press scientific news. A major new study just published in BMJ Medicine shows something important. That stopping GLP-1 drugs like semaglutide or tirzepatide doesn't just reverse weight loss, it reverses heart protection. In over 330,000 patients, even a 6-month interruption increased the risk of heart attack, stroke, and death. And here's the key. The longer you stop, the higher the risk, up to 22% increase. So scientifically, what's happening biologically? Blood pressure rises, cholesterol worsens, inflammation rebounds. I call this so-called metabolic whiplash. So really the bottom line is that these drugs are not just for weight, they're cardiovascular therapies, and therefore continuity matters. I hope this helps.
Do you know that GLP-1 medications can affect your V, your downstairs? If you do not know me, my name is Moxie Rose. I am a spicy educator, and I'm the in-house Quink educator and spokesperson for Shop Quinky. And at this point, I feel like pretty much all of us have in one point or another heard a reference to GLP-1 medications. Even though there's multiple medications that qualify as GLP-1, I feel like the most commonly used anecdotal name that everybody knows it by is Ozempic. This also is not specific to how you are using GLP-1 medications. This can happen to somebody who is specifically using it because they are a diabetic and require it as a diabetic medication. It can happen to the people who are specifically taking it for weight loss. Because in either case, it is still going to cause that weight loss. GLP-1 medications can affect your pelvic floor. That goes for everybody. That can happen to anybody. Whether you have a P or a V, it doesn't matter. You've got a pelvic floor. And for those issues, it usually is being presented as incontinence, not being able to hold it in if you have to go to the bathroom. Other ways that we're anecdotally seeing side effects, and I say that because we are just now having these like ongoing long-term studies done around the effects of the body with GLP-1 medications. So they haven't even like had a chance to get there yet. But in general, anecdotally, what we are seeing is often affecting people with a V, because not only are they potentially experiencing the incontinence issues, they're also experiencing what happens with the rapid weight loss that can happen with your body. Because when you lose weight rapidly like that, especially because of something like a GLP-1 medication, you don't really get to dictate to your body where you do and do not lose that fatty tissue. It's going to do what it's going to do. And you do have a layer of protective fatty pads in the outer part of the V. This part out here, this part all around the entrance to the V. And when you have a sudden and rapid decrease in that fatty tissue, like a lot of other parts with the body that it happens to, it can leave the skin sort of sagging. We've seen this with like arms, with stomach, the tissue that's kind of like sagging a little bit because the fatty tissue that was kind of bulking it up from the other side is gone. But for that particular area, this can cause a lot of discomfort because if you have this extra sort of sagging tissue, it's getting pinched and caught in different things. In addition to that, we are also seeing a lot of reports of people experiencing dryness in the V. Maybe you and or your partner are somebody that wholeheartedly believes that the amount of natural slip and slide that your body produces is a direct correlation to the amount of spicy feelings that you have. Those spicy feelings, that wanting to do things, that can definitely trigger the increase in production of it. But if you're struggling to produce it in general, that's not going to solve the problem. The problem with ignoring symptoms like that is that you tend to ignore things that can help with that symptom. If you are unwilling to admit to yourself that you are experiencing dryness, or even that that's a possibility with the medication you're taking, you may be more likely to overlook potential solutions to something like that, like increasing the amount of slip and slide bottled and trying to grit and bear through that instead of just going and getting that slip and slide. It can cause micro tears. It causes pain during spicy time. So if you were somebody that thinks that you might be experiencing those issues and maybe it is because of your GLP-1 medication, make sure you talk to your doctor about it. But also remember, it is never a problem to get store-bought items that help with those symptoms.
This is the most serious and common side effect associated with Ozempic that nobody talks about. I'm Real Dr. Babe, board certified plastic surgeon, and this is the secret. Remember that one of the ways these medications work is they suppress your appetite so you eat less and lose weight. That's great, but you also drink less, or at least you forget to drink as much as you should, and that can lead to dehydration. Dehydration can lead to kidney problems, but most commonly, it just makes you feel absolutely awful. You're afraid you're dying, and it's something that's easily avoidable and also easily treatable. So if you're feeling really thirsty like this commenter, or you're having a headache, or you're just not peeing enough, and you just feel overall really, really lethargic and awful, it may be dehydration. So you need to get ahead of that and drink a lot of fluids every single day. If you're too far gone and you want immediate relief, then you can come in and actually get IV fluids, and that'll replenish that lost volume.